It is the #1 health problem in the nation because it affects our youngest people.
It accounts for just a huge dollar expenditure every year. Latest estimates, 2005, were about $26 billion per year. It's obviously higher than that now. And that doesn't take into account long-term disabilities and costs for caring for these children.
It's been a difficult challenge for the medical field to make an impact.
We as a society have to make people aware of just how horrible this is so that they can potentially help to solve the problem.
I never knew that I was at risk for preterm birth. I was never told. With all the ultrasounds that I had taken and all the doctor's appointments I've been to, I was never told.
I didn't know anything about preterm birth, nor did I really think about preterm birth at all.
Yes, it does concern me that no one has talked to me about the preterm risk because my last pregnancy was a preterm baby.
They've frankly given up that we can do any better.
We've got to have a massive shift in our mindset of what can be done.
That's kind of the irony of it. We do very good with taking care of early preterm babies, but on the other side, we do a horrible job at preventing them.
I think we need to wake up. I think we need to get angry. We need to demand that we get better outcomes.
So I think we get a false sense of security as obstetricians by having these wonderful neonatal intensive care units right next to us and say, oh, you delivered early, but baby's going to the ICU, and you've got all these specialized personnel and equipment and laboratories and x-rays and ultrasound, and the baby's going to be fine.
My son was born at 36 weeks, and to us, we pretty much thought that that was almost a full-term baby. Everyone pretty much said, once you got to 36 weeks, you'll be good. That your child will be good, everything should be fine.
If I was at risk for preterm birth, no, I would want to know so I could know what to do to prevent it.
Economic burden, but it probably is dwarfed by the emotional problems, the family problems that both these children and their families have as a result of preterm birth.
Having a preterm baby for me, I felt alone because I didn't have anyone. It was just myself. It was the church. The church was there, but I didn't have them there. It was just myself and my children. And I didn't understand why my baby stayed sick a lot. I didn't understand why she had to drink special milk. I didn't understand why she couldn't lift her head. I didn't understand why she couldn't crawl and just do normal baby things. I didn't understand those things.
Looking back at our journey through everything from preterm to dealing with autism, God, the feelings come across as exhausted, grateful. I'm exhausted from everything we've had to go through mentally, physically, everything my body has had to go through. And now I'm grateful that I have 2 healthy kids. And then I kind of do have that feeling of anger, I guess. Because it is, you don't know why, you don't know who to blame. I don't know why I had preterm births. There's still that unknown reason of why I had them, and a little angry of wanting a child that's going to be normal.
Prematurity has also broken up family units because of the relationship strains on dealing with complications of medical issues and how it disrupts life and disrupts finances.
I use the words, we've been through hell and back, and it's the truth. We have gone through everything you could think about that could happen to you, and we felt like it has happened to us.
We'd have probably more functional members of society that could be more productive if they weren't enduring consequences of prematurity.
Very few tools to work with. One of the big problems is trying to determine who is at increased risk for preterm birth.
If we just catch a woman at the time of her preterm labor, our hands are really tied in terms of really helping that baby out after the time it's born.
When you experience preterm birth, if you don't know anything about it, it happens so fast that you don't get a chance to even educate yourself because you are getting the knowledge as it's happening to you, which is scary. You feel a little bit out of control. And at 24 weeks, when she was extremely low, apparently we were already past the point of being able to do a cerclage.
If you could screen for it like you can for some other health problems like breast cancer, like cervical cancer, like prostate cancer, you know that people are at risk for it. Is there some way to detect those people ahead of time before they're actually in the throes of preterm labor?
We still need to look at the low-risk patient because it's not a no-risk patient.
Because I was a first-time mom, that I kept saying, how am I gonna know? How am I gonna know? And that part was scary.
I think that all pregnant women should be informed about preterm birth.
If we're going to take a preventative approach to trying to prevent preterm birth, you absolutely have to have the ability to predict early in the course of events.
It's important to predict risk early because it gives you more time to be able to institute interventions that might modify that risk of preterm birth. Centering or group prenatal care is a very exciting topic right now, being instituted in a number of different medical centers and showing some very promising outcomes in terms of lowering preterm birth rates. And this would be a concept of group prenatal care, where some of the prenatal care is done by obstetricians, part of it is done by nurse practitioners or other people working at the prenatal clinic. It involves more intensive nutritional and dietary counseling. And I think, and perhaps most important at all, a lot of support amongst the women who are pregnant in the prenatal care group.
If I was brought into a centering group where other women are going through what I'm going through and we can share, with what we're going through and share stories and give advice, I would love that.
There's mounting evidence from a number of different studies right now that there are a lot of interventions that can be shown to be effective in preventing preterm birth.
Prior to Gina going to the hospital, I knew absolutely nothing about preterm birth. My biggest concerns at that time were getting the nursery ready because that was my job, that was what I was supposed to do. And you count backwards from 40 weeks and you're like, okay, I need to do X, Y, and Z before 36 weeks and we'll be okay, as long as the nursery's ready by 36 weeks.
It's been claimed that if you inform people about an increased risk of having a preterm baby, it makes them more anxious and more likely to deliver preterm. I think it's pretty much agreed that that's very paternalistic and just not true.
If I was told by my doctor that I was at risk for preterm birth, I would have felt ready. I would have definitely informed myself on what to expect, and I probably would have reached out to other mothers who had experienced what I was going through, get support. I would have gotten into a support group, definitely.
If we don't prepare the parents and say, we've got a risk of preterm delivery, I want you to be aware of that, I want you to take precautions, I want you to be proactive, call the office when you have these particular symptoms, then we're just going to ignore the problem.
We want to take all the precautions possible.
Do a little bit of educating and know that, now doctors can actually, the success rate for your child being preterm are so much higher than they were. And education is the power to everything. Your knowledge is the power to everything. So you as a parent, the more you know, the more you're going to help your child out if they're in that situation.
empowering patients. I want you to call if you have these signs or symptoms.
It is our responsibility to provide that information, and it is their right to have that information.
We can change. We can change this. We can make a difference if we want to. We can do something about preterm birth. It takes a change in attitude, it takes a change in motivation, it takes a change in the way we do obstetrical care.
If we keep searching for the answers, eventually we're going to find something that works better and keep improving on our outcomes, hopefully. We just can't give up on these babies. We've got to keep fighting for them. So in an ideal world, we'd love to have that screening test, an accurate diagnostic test, and the tools to effectively treat someone so that we can reach our ultimate end goal, which would be a term delivery.
1 week prolongation of pregnancy can mean a lot in terms of improvement of health for the baby. If you can prolong pregnancy for a week or a week and a half, that has a huge impact both on preterm delivery rates and on potential cost savings. I think there's some evidence to show that you could reduce that neonatal costs per year of $26 billion down by even $6 or $8 billion by just extending pregnancies for an additional week or two. You may be able to delay the onset of preterm labor and hence prevent preterm births to the point that you could save a week.
If we could predict preterm delivery earlier in its course, I think neonatal outcomes would be much better in that even if they're premature, hopefully they're less premature. The consequences of less severe prematurity are certainly much less, and hopefully would lead to fewer permanent handicaps.
We can make a difference, maybe in one baby's life, maybe in one family's life.